after the protein myth, which is you have to eat meat to get enough protein, and after the calcium myth, which means you have to eat enough dairy to get enough calcium, comes the omega-3 myth. And that is you need to eat fish to get essential fats, to grow your brain, to be healthy, to have a normal pregnancy, etc. You need to be eating fish fat. Well, let's take a look at that recommendation for a minute. Omega-3 fats, what this means is that somehow a metabolic process has been able to remove some hydrogen at the carbon number 3 position. In other words, 1 carbon, 2 carbons, 3 carbons. At that position, what we cause is a double bond. That's why we call it omega-3. Only plants have the ability to cause that to happen. Only plants have the ability to take the hydrogens away at the carbon 3 position, to create a double bond at the carbon 3 position. Only plants. So how in the world does a fish have all this omega-3 fat? The fish ate algae or seaweed, which made the original omega-3 fats. Okay, so the fish does concentrate a lot of this fat in its body fat. Is that good or bad? Well, it could be good in some ways. It acts like a drug. It thins the blood, which may reduce your risk of forming a blood clot, which leads to a heart attack. But ladies and gentlemen, it thins the blood. And if you get in an accident, you're more likely to bleed to death with all that thin blood. It suppresses the immune system, these omega-3 fats do. And if you have an inflammatory arthritis, it can reduce this swelling and the pain associated with the arthritis, but it suppresses the immune system, ladies and gentlemen, the whole immune system. As a result, you cannot defend yourself against cancer or infections as readily as you would if you didn't include these in your daily regime. They suppress the immune system. They're also pure fat. The fat you eat is the fat you wear. And when biopsies are done of fish eaters, we find that they're full of omega-3 fats when we look at their body fat. Now, that's just part of the problem with deciding you're going to get your omega-3 fats from fish, as opposed to the original source, which is the plants, which is what you ought to be doing. Other problems that are associated with that are the fact that fish are bioaccumulators of dangerous chemicals. What happens is the fish, they come along and they eat the seaweed and they eat the algae, and on this seaweed and algae is a small concentration of environmental chemicals produced by industry, primarily factories. And these get into the water, the ocean, the rivers, the lakes, streams, et cetera. And they get on the plants, and the fish comes along and eats the plants. And because these chemicals are fat soluble, these chemicals are concentrated in the fish fat. Maybe a 500 or 1,000-fold, they're concentrated in the fish fat. And then what happens is a bigger fish comes along and eats the little fish. And because you have to eat a lot of little fish to keep the big fish going, you end up taking a large amount of these chemicals. And so you further biomagnify the dangerous cancer-causing, brain-damaging chemicals that are in the environment. And then, of course, we're at the end of the food chain, and we end up eating the fish. So you end up with a tremendous amount of environmental contaminants. And probably the most notable of them is methylmercury. Methylmercury is very toxic to the body, particularly to the kidney system. And you can determine how much fish a person enjoys eating based upon the methylmercury levels in their body fat, in their bloodstream. You can tell how much fish they eat. It's a direct relationship between methylmercury and fish consumption. Those are just some of the concerns. In addition to it being high fat, which is going to make you fat, that extra fat makes you diabetic. Fat causes the body to develop insulin resistance, paralyzes the activity of insulin, contributes to diabetes. Fish oils, they contribute to cancer. Yeah, these omega-3 fats, not only do they suppress the immune system, but in other ways, they contribute to cancer development. So you end up with a whole bunch of health problems. Also consider that fish has no dietary fiber. So it's not going to contribute to a large, healthy bowel movement. But one of the biggest concerns that I think you should have, and I certainly have as a grandfather, and you should as a parent, is the fact that the fish are almost gone. I've been interested in the ocean my entire life. I've been a windsurfer, an ocean-going boat sailor, I've enjoyed scuba diving. I just love to listen to the waves, live by the ocean during part of my life. The ocean is very important to me, and I've always wanted to show it to my children. And I've had an opportunity to do that. But will we have that same opportunity for our grandchildren? It's in question because 90% of the fish that were present when I was a young boy are gone through overfishing, through bycatch. The fishing industry certainly needs some regulation, which is unlikely to come because of the finances involved. But you as an individual can make a choice. You can understand that the downside of eating fish is far, far greater than any benefits that you might accrue. Stick with a healthy diet, which is a starch-based diet with the addition of fruits and vegetables, and leave those little fishies alone. I'm Dr. John McDougall.